present the rationale of why immunizations are so important for children. And, you know, myself and those us at CMDS, we feel strongly that immunizations are very important, and we want to get the message out there and debunk some of those myths and answer some commonly answered questions about immunizations. At the end of the talk, there'll be a question and answer period, which hopefully we can, if you have any questions, we can address them. All right, so let's begin. And please, anyone stop me if you can't hear me or if I'm talking too fast, please let me know. Thank you very much. All right, so the presentation overview, what we're going to do is we're going to talk about a case for immunization. We're going to talk about vaccine safety. We're going to talk about vaccines in Canada, and we're going to talk about myths, facts, and commonly asked questions. And then we'll have a time for questions and answers, as I said. So just so, this is more for parents. This guide is sort of the definitive guide for immunizations, published by the Canadian Pediatric Society. It's called Your Child's Best Shot. I highly recommend it. Also, for updates, including position statements from the CPS and other current information for parents, you can visit the CPS website, the Canadian Pediatric Society website, and caringforkids.cps.ca, and also the health agency, the Public Health Agency also has a website that's very helpful. And it also has the complete immunization schedule for every province in Canada. So let's talk about the case for immunization. So why do we immunize? Well, vaccines save lives, and it's been a public health success story. The U.S. Centers of Disease and Control calls vaccination one of the 10 great public health achievements of the 20th century. All vaccine-preventable diseases have declined significantly in countries with successful immunization programs. Smallpox has been eradicated, and polio is non-existent in this part of the world. Vaccines are safe and effective. The diseases they prevent can cause permanent disability or even death. It's a small world. Travel can spread rare diseases quickly, and many vaccine-preventable diseases have no effective treatments. Diphtheria, 1 in 10 people die even with treatment, and meningococcal disease, 1 in 10 also die even with prompt effective treatment or prompt treatment. For some diseases like tetanus, infection does not produce immunity. Vaccines produce immunity. Last but not least, vaccines protect everyone. Directly, the person vaccinated, and indirectly, people who are vulnerable to disease. Example, babies, children, and the elderly, and people with a weak immune system. So for example, babies are protected when older people, caregivers, get a pertussis vaccine, the influenza vaccine. Vaccines keep communities healthier. Children in school, parents, they stay in school, parents continue to work, people interact normally. So how do vaccines work? Well, let's talk a little bit about immunology. So bacteria and viruses have unique proteins and polysaccharides, complex sugars on their surfaces called antigens. The immune system targets antigens using antibodies and lymphocytes. Lymphocytes are a type of a white blood cell and include B cells, T cells, and memory cells. And memory cells enable the immune system to recognize germs it has seen before, creating immune memory. Long-lasting immunity depends on memory cells. Immune memory is the ability the immune system acquires to identify the presence of a germ and destroy it. There are two ways to achieve immunity: natural infection or immunization. Natural infection causes illness and can lead to complications, permanent damage, even death. Vaccines protect without causing severe illness. So this table kind of presents what the different types of vaccines are. So you can have inactivated vaccines. So the top three show killed, either intact or disrupted viruses or bacteria, such as inactivated polio vaccine, oral cholera vaccine, influenza vaccine. And then the bottom ones, the bottom four, are also inactivated vaccines. And you can have purified components of bacteria or viruses, such as acellular pertussis vaccine, the Haemophilus, pneumococcal, meningococcal, Hep B vaccine. And then you can have toxins, such as diphtheria or tetanus. And then you can have live, attenuated, weakened viruses, such as MMR and Varicella. And these infect cells and multiply in the body, but they have been sufficiently weakened in the lab so that they stimulate immunity without causing full-blown infection. So, as I said, vaccines have been a public health success story. I just want to highlight a few here. So for polio, the last epidemic was in 1959, and there were 2,000 cases of paralytic polio in Canada during that time. Today, there are none. Before the measles vaccine was introduced in 1963, almost every child got measles. There were about 300,000 cases per year. Since 1998, there has been less than 20 cases per year, a 99.9% reduction. Before the vaccine, measles killed 300 children a year and left another 300 with brain damage. Today, there are no measles-related deaths in Canada. Other examples, since 2005, when routine vaccination for infants for pneumococcal disease began, there has been a 94% reduction in invasive forms of the disease, such as meningitis, septicemia, and bacteremia. Same for chickenpox. Since 2006, when routine vaccination began, there has been a dramatic reduction in the number and severity of cases, especially among preschool children. So let's talk a little bit about the risks and benefits of vaccines. So some opponents of immunization claim that vaccines carry unnecessary risk. So this table compares the specific effects of each disease with the side effects of each vaccine. When you even see at a glance, the benefits of vaccines far outweigh the risks of disease. So for example, diphtheria causes severe sore throat, marked weakness, nerve damage, and heart failure, death in 10% of cases. While that vaccine really only causes local swelling, redness, and pain, and less than 5% have fever. For tetanus, it's a toxin that affects nerve endings, leading to painful muscle spasms and seizures. Again, the vaccine only causes local redness and pain. Pertussis can cause severe spasms of cough lasting 3 to 6 weeks, pneumonia, convulsions, brain damage, or death in 1 of 400 infants. And it's the same vaccine as in diphtheria and tetanus, really only causes pain and local redness. There is the risk of brain damage after pertussis vaccine is too small even to be measured. Polio, muscle paralysis can happen in 1 of 100 people, and death in severe cases. With the inactivated polio vaccine, there is no risk of disease. Haemophilus influenza, meningitis kills in 5% of cases and leads to brain damage and deafness in 10 to 15% of survivors. Given in combination with the above, it has the same side effects, which is minimal. For measles, it can cause severe bronchitis, high fever, rash for 7 to 14 days, and death in 1 in per 1,000 cases, and encephalitis in 1 in per 1,000 cases. When it's given combined with mumps and rubella vaccine, you might see 5 to 10% of people having fever with or without the rash 8 to 10 days after the vaccine is given. There's no risk of disease from the vaccine. There's a very small risk of encephalitis, 1 case per 1 million doses, and 1 in 24,000 develop low platelets. For mumps, you may have seen recently in the news of the NHL players being off their sports, the swollen parotid glands. It can cause fever. Again, the swollen parotid glands, no visible illness in greater than 50% of cases. It can cause encephalitis in 1 per 200 cases and deafness in 1 in 200,000 cases. And it's in the same vaccine as the measles virus. For rubella, you can get fever, swollen glands, and rash. And then if a mother gets it while pregnant, it can cause severe damage to the fetus. It's in the same vaccine as the MMR. Pneumococcus, there's death in approximately 30 to 50 children, and 15 to 20% of survivors of meningitis have brain damage and deafness. With the vaccine, there's only local redness, swelling, and pain. Varicella can cause hospitalization in 1,000 and death in 10 cases per year due to pneumonia, encephalitis, or severe skin infections, and you can get shingles later in life. The vaccine only causes minor local reactions. Hepatitis B, death from complication of chronic infection, such as cirrhosis, liver cancer, or from severe acute illness. And the vaccine only causes minor local redness, swelling, and pain. Meningococcus, death in 10% of cases. Brain damage, deafness, amputations, and skin loss in 10% of survivors. And the vaccine only causes local redness, swelling, and pain in 15% of recipients. Hepatitis A, death can happen from overwhelming liver damage, and the injection only causes pain and redness from the vaccine injection. So HPV, you can get death from cervical and other forms of cancer, and the vaccine only causes mild redness and pain. And rotavirus can cause death from severe dehydration caused by profuse watery diarrhea. So you can see that the benefits of vaccines far outweigh the risks of disease. So what are these success stories? So smallpox, as we said earlier, has been eradicated. There's no cases anywhere in the world since 1979. Children are no longer vaccinated against smallpox. Paralytic polio has been eliminated from most of the world. Today it is endemic in only 4 countries, which are Afghanistan, India, Nigeria, and Pakistan. Cases dropped from 350,000 in 1988 to 1606 in 2009. There have been recent outbreaks in the former Soviet republics of Tajikistan and Uzbekistan. To completely eradicate it, all children must be vaccinated. Why do we still immunize? When vaccination rates decline, rates of disease increase. For example, in the 1980s, the former Soviet Union saw vaccine supplies disrupted, collapse of the public health system, and socioeconomic instability. What was the result? Well, there was a decrease in child immunization rates. A diphtheria epidemic followed, more than 150,000 cases and more than 4,000 deaths in the newly independent and Baltic states. Mass vaccination program eventually controlled the epidemic. So what's our lesson? Complacency can be fatal. So why do these outbreaks still occur? They can occur for several reasons. Public doubt. So I'm sure most people have heard in the early 2000s, there was a flawed autism MMR study in the UK that led to significant decrease in the measles vaccination. Local measles rates went up, and so did deaths, and measles spread to other countries. So what did we learn? Vaccination must continue to prevent disease outbreaks. Travel can cause outbreaks. Measles and mumps have been introduced into Canada by travelers, causing local outbreaks. In 2008, polio spread by travelers from the 4 countries where it remains endemic to 20 others. What's our lesson? It's a small world. Travel can spread a rare disease very quickly. Also, why do outbreaks still occur? Because of waxing immunity. There's a large mumps outbreak in 2007 and 2008. It started in Nova Scotia, spread to New Brunswick and Alberta, with sporadic cases elsewhere. It mainly affected 20 to 29-year-olds in school settings. So what happened is this prompted a recommendation for a second dose of vaccine for high school, college, and university students, and actually healthcare providers and military who have only received 1 dose in early childhood. So our lesson is that there may be a need for a second booster dose of the mumps vaccine. Right now, so if you're in healthcare, as I said, if you're a student, if you're in the military, if you're traveling anywhere internationally, you need to get a booster dose, but they're hoping that in the future that everyone's going to be required to get a second booster dose, because there are still people out there walking around with decreased immunity to measles, mumps, and rubella. So let's talk about vaccine safety. So how vaccines are approved for use in Canada? Let's just go over it briefly so everyone understands. So the Biologics and Genetic Therapies Directorate with Health Canada reviews and approves all vaccines for human use in Canada. To be approved, vaccine providers must meet acceptable standards of safety, quality, and efficacy. For production, all aspects of production are supervised by the BGTD, and the BGTD does independent lab testing to evaluate safety and efficacy of early batches of vaccine. In terms of quality, it is specified by the BGTD and repeatedly tested by lot sampling before and after the vaccine is released for sale. So recommendations for vaccine use. So once a vaccine is approved for use, expert groups make recommendations on how it should be used. The National Advisory Committee on Immunizations makes recommendations to the Chief Public Health Officer. The Canadian Immunization Committee assesses NACI's recommendations and advises on operational plans. Provinces and territories use NACI and CIC recommendations to develop immunization programs. And then the NACI develops the Canadian Immunization Guide, and it's published every 4 years on the Public Health Agency of Canada website. The Canadian Pediatric Society produces position statements, which also can be found on their website. So we monitor vaccine safety. So what's the adverse event? It's in health effects occurring after immunization that may or may not be related to the vaccine. There are mild adverse events such as fever and swelling at the injection site, which are common. And more serious reactions are rare. Post-marketing surveillance of adverse events. So the system for reporting and reviewing adverse events once a vaccine has been approved for use. That's what post-marketing surveillance of adverse events is. Information gets to the Public Health Agency of Canada through doctors and nurses reporting to health officials. So doctors and nurses providing vaccines should know the local procedure for reporting vaccine adverse events to public health. And through this surveillance, medical experts at the Public Health Agency of Canada are made aware of unusual post-vaccine events. So let's talk about the vaccines that are in Canada. So these are the routine childhood vaccines. So the CPS and the National Advisory Committee on Immunizations recommend that children in Canada receive these vaccines. So schedules for some publicly funded programs, such as the meningococcal, pneumococcal vaccine, hepatitis V, flu, HPV, the schedules can vary by province and territory. But these are the routine vaccines. You have your 5-in-1, which includes diphtheria, tetanus, pertussis, polio, and Haemophilus influenza. MMR protects against measles, mumps, and rubella. You have Hep B vaccine, Varicella chickenpox vaccine. You have your seasonal influenza. And then you have your booster dose of tetanus, diphtheria, and pertussis for teens and adults. Your pneumococcal vaccine, meningococcal vaccine, your HPV vaccine, and rotavirus. And again, as I said earlier, complete immunization schedules can be found at the Public Health Agency of Canada for all provinces and territories. And there is a catch-up schedule just to be aware of. Children with certain chronic conditions who travel outside of North America may require additional vaccines. Or children new to Canada who have not yet received vaccines, which are routine here, may need to be put on a catch-up schedule. And children who move within Canada may miss a dose of vaccine because the schedules are not uniform across the country and may need to catch up and receive extra vaccines. Let's talk about contraindications to vaccination. So anaphylaxis or another serious allergic reaction after receiving a vaccine is a contraindication to further doses of that vaccine. However, egg allergy is not a contraindication to the influenza vaccine. Previously in the past, it was a contraindication, but they found it such a low risk that it's no longer a contraindication. You give a full dose of the flu vaccine to children with egg allergy. People with certain immune system disorders should not be given live vaccines, measles, mumps, rubella, varicella, or oral typhoid, to name a few. And all live vaccines should be avoided during pregnancy, except when expected benefits to mother and baby outweigh the risk. There has never been evidence that a live vaccine may affect the fetus, but damage has only been reported with the smallpox vaccine, but we don't have any evidence, so we continue to recommend to avoid them. So let's talk about precautions. So when do we delay giving a vaccine to a child? We would delay it if there's a moderate or severe illness, and the reason is because we don't want to attribute the symptoms of the child to the side effect of the vaccine. or we also delay it when people have been treated with blood products. For 3 months or more, we would delay the vaccine because the vaccines would not work in that circumstance because some of the blood products may contain antibodies against the vaccine. We don't delay vaccination because of minor illness, such as cough, cold, with or without fever. So let's go and we'll talk about each one of the vaccines briefly. So here's diphtheria. It's caused by a toxin made by bacteria that infects the nose, throat, or skin. It can cause breathing problems, heart failure, nerve damage, and kidney failure. About 1 person in 10 dies. It can be spread by close, direct contact with droplets from a cough or sneeze. And before 1900, it was one of the main causes of childhood death. Since 1983, post-vaccination, less than 5 cases per year occur, and there are no deaths. Tetanus is caused by a toxin made by bacteria that block normal control of nerve reflexes in the spinal cord, also known as lockjaw. It's not contagious. It spreads through spores, seed-like cells in the environment, especially contaminated soil and dust. Before vaccine, 60 to 75 cases per year occurred in Canada, with 40 to 50 deaths. Today, less than 2 cases occur per year in Canada. Since tetanus spores are in the environment, vaccination is the only means of prevention. Infection does not produce immunity to tetanus, and in countries without vaccination, tetanus still kills. Pertussis. It's a respiratory infection caused by bacteria, also known as a whooping cough. It can cause severe coughing spells followed by a whoop sound. It can last up to 6 to 12 weeks. 20 to 30% of infants are hospitalized. 1 in 400 will have brain damage. It's very contagious. It's spread by close, direct contact with droplets from a cough or sneeze. Before vaccination, 30 to 50,000 cases per year occurred, with 50 to 100 deaths. Today, there are 3,000 cases in Canada, with about 5 deaths per year. In recent years, there's been an increasing number of cases in teens and young adults. Pertussis is still a common cause of chronic cough in teens and adults. Polio. It's caused by poliovirus. Before 1955, it was a common infection in Canada. Most infections are asymptomatic, but it can cause meningitis, and 1% can get paralytic polio. The virus is in the throat and feces of people who are infected. It spreads by close, direct contact with throat secretions and indirect contact, such as contaminated hands, water, and food. In 1959, as previously mentioned, that was the last epidemic in Canada, and it's now been eradicated from Canada. What about Haemophilus influenza? Not to be confused with seasonal influenza. Young children are most at risk. Until 1985, it was the most common cause of bacterial meningitis in Canada, with 1,500 cases per year. And then another 1,500 cases have serious infections other than meningitis, such as sepsis, bacteremia, epiglottis, lungs, joints, bones, and skin problems. Without treatment, all children with meningitis die. Complications from Haemophilus meningitis include brain damage, developmental delay, speech, language disorders, and deafness. It's not highly contagious. The bacteria is in the mouth, nose, and secretions, and it's spread by close, prolonged exposure or contact with droplets from a cough or sneeze. And this also is a success story. So in 1986, the vaccine was approved for use in Canada, and since 2000, 5 to 16 cases per year of invasive Haemophilus disease occur in children. Haemophilus disease is disappearing from every country with routine immunization for infants. Pneumococcal disease is caused by strep pneumonia. It's the most common cause of meningitis and other invasive serious bacterial infections in children in Canada, especially in children less than 2 years of age. Older children, teens, and adults with certain chronic conditions are also at higher risk. Many people are asymptomatic carriers and have no symptoms. It's not highly contagious. It spreads through close, direct contact, and children in daycare are most at risk. It can cause local infections, acute otitis media, sinusitis, bronchitis, pneumonia, and invasive infections such as meningitis, bacteremia, sepsis, endocarditis, septic arthritis, osteomyelitis, peritonitis. And they are becoming antibiotic resistant. Again, this is another success story, as I previously mentioned. There's a 94% decrease in invasive disease in children less than 2. Meningococcal disease is caused by Neisseria meningitidis, can cause meningitis, bacteremia, sepsis, and other invasive infections. Before the vaccine, 200 to 400 cases of invasive infection per year occurred in Canada, with 20 to 40 deaths. Since 2001, the rate in Canada has decreased to about 200 cases per year. People with certain chronic disease are at higher risk. There's death from serious disease in 5% of cases, even with treatment, and it can occur within 6 to 12 hours of the first onset of the illness. Most spread via healthy carriers, about 1 in 5 adolescents and adults, by close direct contact with mouth secretions and respiratory droplets. And there's 5 serotypes, A, B, C, Y, and W135. And these are the ones that cause nearly all the infections in Canada, with groups B and C causing the most illness. Measles, it's a severe viral illness, causes high fever, runny nose, cough, conjunctivitis, and rash of 1 to 2 weeks. Pneumonia is common. Encephalitis occurs in 1 in 1,000 cases and can lead to brain damage or death. In rare cases, it can cause subacute sclerosing panencephalitis years down the road. Very contagious, spread by direct contact through the air, and germs become airborne in a cough or sneeze. Before the vaccine, there was large epidemics every 2 to 3 years, and most children acquired measles by 18 years of age. And there were 300,000 cases per year in Canada, with 300 deaths and 300 children with brain damage. In 2001-2006, there was fewer than 20 cases per year. And the recent 2014-2015 outbreak, I think there's probably more cases now, but at one point within the last week, there were 29 cases reported in Ontario, Quebec, and Manitoba. And these serotypes that they're finding in Canada are from measles viruses found in other parts of the country. So it seems to be travel related, affecting people who are not immunized. So mumps, viral infection can, it's a viral infection that can cause fever, headache, and swelling of salivary glands around the jaw and cheeks. Can also cause a mild form of meningitis in 1 in 10 cases, or severe encephalitis leading to brain damage. There's multiple complications, including deafness, swelling of testicles, infection of ovaries, and rarely sterility. The virus is in the mouth and nose secretions and spreads easily by close direct contact, and in droplets from cough or sneeze. And there's an increasing number of cases in adolescents and young adults since 2007, which reflects waning immunity after a single dose of vaccine. Rubella. Rubella is also known as German measles. It can lead to fever, sore throat, swollen glands, and a rash. It's usually mild in children. It's more severe in teens and adults and can also cause arthralgias and arthritis. And pregnancy can infect the fetus, causing severe disabilities called congenital rubella syndrome. Results in heart disease, deafness, cataracts, and mental retardation. Can spread by direct contact with mouth or nose secretions and droplets from a cough or sneeze. Less contagious than chickenpox or measles. Before the vaccine, 85% of children had rubella by age 20, and there's 250,000 cases per year, with 200 cases of congenital rubella syndrome. Again, another health success story. Since immunization began in 1980, there's only 0 to 3 babies with congenital rubella syndrome born in Canada every year. What about varicella? It's caused by varicella zoster virus. It causes fever, headaches, aches and pains, and itchy rash. It's usually mild, but it's a costly disease because parents often have to stay home for 3 days. Children are brought to a clinic or hospital, and parents have to be off work and taking care of their children. It can lead to complications such as pneumonia, bacteremia, or severe skin infections. The illness tends to be more severe and more complications occur in adults and teenagers. Severe cases can pose significant health risks, especially for newborn babies, adults, or anyone with a weakened immune system. And again, this one's highly contagious. Viruses from the throat and scratched skin lesions can spread through the air, and also spreads by direct contact with the rash. It's contagious 2 days before the rash appears, and until the last blister has crushed, about 5 days after the rash begins. And it remains dormant in the nervous system and can be reactivated later to cause shingles. Hepatitis V is a viral infection of the liver. Half of infected people have no symptoms, and others can be ill with fever, fatigue, loss of appetite, and jaundice, which can last weeks or months. 10% become chronic carriers, and they can develop liver disease or cancer later. It's spread through the blood and genital secretions. It's found in very low concentrations in saliva, but not in breast milk. Sexual activity and shared needles are the most common means of spread. And it can be passed by an infected mother to a child during pregnancy or delivery. Before the vaccine, there was nearly 500 deaths per year in Canada, and about 1 person in 200 was a chronic carrier. All right. So seasonal influenza. So influenza virus causes yearly epidemics of respiratory illness, and it can cause periodic pandemics when the virus changes subtly and no one is immune. During outbreaks, hospitalization rates increase for infants and elderly. It's highly contagious. It can spread in respiratory secretions, on contaminated hands, droplets from a cough or sneeze, and on contaminated objects or surfaces. It spreads easily in schools and childcare settings. Children bring the infection home to family members. There's lots of complications such as pneumonia, otitis media, febrile seizures, severe muscle inflammation, and encephalopathy. So the annual influenza vaccine is recommended for people at high risk of complications. So definitely children who are 5 years of age or younger, or older children with certain chronic disorders, and parents, siblings, household contacts, and caregivers of high-risk children. The HPV vaccine is a newer vaccine, so it's most common. HPV is the most common sexually transmitted infection in Canada. Its prevalence in Canada is between 11 to 29%. The highest rates of HPV acquisition occur within the first 5 years following onset of sexual activity. Usually there's no symptoms, but it's a major cause of cervical and vaginal cancer in women, and it can also cause genital warts. On average, there was 1,350 cases of cervical cancer diagnosed per year in Canada, with 400 deaths, and 200 deaths from other forms of cancer caused by HPV. But the vaccine can be highly effective in preventing infection with the most common cancer-causing types of HPV. The data is still too new to determine the long-term effects of disease rates. Yeah. Rotavirus. So our last one, rotavirus is the leading cause of acute diarrhea in babies and young children worldwide. At least 20% of all childhood gastroenteritis is caused by rotavirus. Almost all children are infected before 5 years of age. Outbreaks happen usually between February to May and cause fever, vomiting, severe watery diarrhea, and rapid dehydration in young children who cannot keep down enough fluid. This is rare in the Western countries, but in the developing world, rotavirus kills as many as 5 in 100 children before their 5th birthday. It's highly contagious before and after symptoms develop. And viruses in the stool spread easily by contact with contaminated hands, objects, or surfaces that then touch the mouth. The vaccine has been very effective in preventing severe disease and hospitalization. So why don't we talk about myths, facts, and commonly asked questions. So myth number 1, vaccines can cause brain damage and other illnesses that can't otherwise be explained. So vaccines have been blamed for a number of problems that science cannot fully explain, such as SIDS and the diphtheria vaccine, brain damage and pertussis vaccine, and autism with MMR and Marisol. But the thing is, vaccines are frequently given in early infancy. Brain abnormalities are often not recognizable this early. Diagnosis of cerebral palsy, mental retardation, or developmental delays are not usually made until a child is several months old. Abnormalities often is only recognized after 1 or more vaccine doses have been given, but this does not mean the vaccine caused the problem. Any suspected link between vaccination and a subsequent disease leads to intensive scientific investigation. If there is evidence of a significant risk of the disease, the vaccine is withdrawn, and an example of this is the RotaShield vaccine and intussusception. So what's another myth? Rates of disease were declining before the use of vaccines. Until vaccines, there was no significant change in the number of cases of vaccine-preventable diseases. What was changing was the death rate from some of these infections. The improvements in social and economic conditions led to declining rates for many common infections, such as measles and diphtheria. But for other diseases, such as polio, healthy children continue to die or become disabled. What's another myth? Compulsory vaccination violates civil rights. Vaccination is not compulsory, but not vaccinating puts others at risk of disease, compromising their rights. People who choose not to vaccinate their children can be asked to withdraw from school or childcare when outbreaks occur. And so some people do confuse routine immunization with compulsory immunization, but it is not compulsory. What's another myth? Infections like measles stimulate the immune system. No, this is not true. Infection acts as a general stimulus to the immune system. Measles and influenza actually suppress the immune system. So what about the autism myth? Well, in 1998, The Lancet published a study by Dr. Andrew Wakefield, and it appeared to link the vaccine with autism. It caused MMR immunization rates to drop significantly in Britain and it led to a measles outbreak. The study itself has been thoroughly discredited. In March 2004, 10 of the original study's 13 authors published a retraction of their interpretation. In 2010, the UK's Regulating General Medical Council found Wakefield had acted dishonestly and irresponsibly in doing his research. In 2010, the editors of Lancet fully retracted his paper, and he was struck off the medical registry in the UK in 2010. There's been many recent large studies by major medical bodies that have repeatedly shown no causal link between the MMR vaccine and autism. There is a temporal relationship, but not a causal relationship. MMR vaccine is usually given between 12 to 18 months of age, and that's the age when the signs of autism most often emerge. The thimerosal myth. Thimerosal is a preservative used to prevent growth of bacteria and fungi in multi-dose vials of vaccines. It's not added to single-dose vials. In the body, it's metabolized to ethyl mercury. And there's concern in 1999 in the U.S. about possible toxicity of ethyl mercury. In 2004, the U.S. Institute of Medicine review found no evidence of a relationship between thimerosal and autism or any other neurological disease. And there's some further studies to confirm that. The diagnosis of autism continues to increase after thimerosal was removed from childhood vaccines, also going against this argument. Thimerosal is a component in only one vaccine for routine immunization of Canadian children, the flu vaccine. But you can get an influenza vaccine that is thimerosal-free as well. It's still used as a preservative in certain vaccines produced for adults, not children. So, won't breastfeeding protect babies from infections? Breast milk is the ideal food for babies. It provides important nutritional and immune factors and contains antibodies that help prevent some infections. However, this protection is incomplete and breast milk does not protect against all infections preventable by vaccines. Breastfeeding is not an alternative to immunization and does not enhance responses to vaccines. Protection decreases rapidly when breastfeeding stops. Is natural immunity more effective? Immunity after most vaccines is just as effective as that induced by disease, without the risks of disease. Every vaccine-preventable infection can cause serious harm. Immune response to natural infection may be too late to prevent serious harm. With vaccines, the immune system is stimulated to develop protection against the disease without full-blown infection. Another question, shouldn't vaccines be delayed until children are older and there is less risk of side effects? No. Evidence that side effects are more common in infants or babies, there is no evidence that their side effects are more common in infants or babies than in older children. And if you delay the vaccine, it leaves young children at risk of complications. And the complications are most common in children less than 6 months of age, particularly pertussis and pneumococcal infections. Can too many vaccines overload a baby's immune system? Babies are naturally exposed to thousands of antigens every day. Scientists estimate that infants have the capacity to respond to 10,000 different antigens at any one time. Bacteria and viruses expose an infant to large numbers of antigens at once, far more than are found in vaccines. Giving combined vaccines and multiple shots means fewer needles for a child. There is no evidence that giving vaccine components separately is more effective or results in fewer side effects than giving combined vaccines. Another question. Since most other children are vaccinated and diseases are disappearing, why bother vaccinating my child? As long as a vaccine-preventable disease exists somewhere in the world, any unimmunized child is at risk. A traveler may bring the disease to any area, or a child may travel to another area where the disease is more common. And vaccination does not get rid of some germs, such as pneumococcus, which may be still carried by older children and adults. And tetanus bacteria are present in the soil and dust everywhere in the world. Any child can be infected from a dirty wound. Why should my preteen be vaccinated against HPV? Well, the answer is for maximum protection. The complete vaccine series should begin well before sexual activity starts. You want to complete the vaccine series before sexual activity starts. So school-based programs seem to be more effective in reaching target populations in primary school than in secondary school. And young children have a better immune response to the vaccine. There's immune response seen in 9 to 11-year-olds is more effective than that seen in 16 to 26-year-olds. All right. So can vaccines cause the infection they are supposed to prevent? Inactivated vaccines do not contain live germs and cannot cause the infections they protect against. Live vaccines contain viruses that have been changed so they are very weak and unable to cause disease in healthy people. Rarely, they may cause a mild form of the infection. And children with certain immune disorders may develop an infection with these vaccines and therefore should not receive them. All right. Well, thank you so much for listening to my talk. I think you've heard a lot of information about childhood immunizations. And I hope you can see from this evidence that immunizations are safe and effective for preventing serious complications from some of the viruses and bacteria.
All attendees are muted and may unmute themselves by pressing *6.
So I'd like to open it up for questions and answers and or comments. Yes, so please share with me, talk to me. And I don't know if Kevin Ramsey's here. He's an ophthalmologist in DC. If he's here, he may also want to share some of his insights as well.
Yeah, Kevin is here with us tonight, so he can unmute himself at any time to chime in. For the Q&A, you can ask your questions here in the chat window, or you can ask them directly to Shalea over the computer or via phone.
And I'll just move it to my cam so you can see me to make this a little bit more personal. There's Kevin. Hi, Kevin. I've never seen you before. There you are. Hi, I'm Kevin.
Hi. So there is a question here in the chat window there. I don't know if you guys can see that, from Katrina in Dartmouth, Nova Scotia. And she is asking, which of the vaccinations are cultivated using human diploid cells?
That is a good question. Human diploids. I actually, honestly, I'd have to look that up. I'm not quite sure of the answer on the top of my head.
The MMR vaccine, I believe, is the main one that people talk about. Whether or not there are others that are associated with that, I'm not certain.
Kevin, do you have any thoughts that you want to share? Kevin just wrote an article for the Focus magazine, kind of trying to bridge Christian faith and science, and it was very interesting. I don't know if you have any thoughts towards this topic.
Yeah, no, thank you for your presentation. I thought that was a great summary of the existing literature. No, I mean I think it's an important issue for all of us to I have 5 children, so it's something that we have to think about for all of our kids quite frequently as their immunizations come up, and I think it's important. God put us on this world with the ability to think and to study and to act based on what He has provided for us. And I thought that was a great summary of the literature. So I think that's useful.
Thank you.
Yeah, and there's another question here from Stephanie Potter from Halifax. She says, I recently found out that I am pregnant, and my blood work revealed that I have reduced Hep B immunity. What will my doctor probably recommend?
So as long as if you're not hepatitis B positive, then your fetus will not be at risk. If there is any risk of your fetus being infected with hepatitis B, then what happens is your baby will, once born, will receive the hepatitis B immunoglobulin and the hepatitis B vaccine at birth. And probably what would be recommended for you is once you've delivered your baby is to receive the hepatitis B vaccine. Although it's not a live vaccine, so it most likely would be safe in pregnancy as well.
Thank you. We also have another question here in the chat from Dominique Denver from Quebec City. He says, a friend of mine has a daughter who is allergic to sorbitol, a component in corn. She thus delayed having her vaccinated until her corn allergy appeared to resolve. She was then immunized and then developed a rash, nausea, and diarrhea. Her pediatrician in the U.S. advised avoiding vaccination. So now she is not continuing the vaccination schedule. How would you advise proceeding?
That's a very good question. What I would suggest is having her seen by an allergist to do skin testing. Well, what she could do is she could have skin testing done of the various components of some of the vaccines and to confirm whether or not she's allergic. Or what they could also do is do a challenge. They can do administer the vaccine in in small aliquots, to not the full dose, but in portions of it, to see how her child could respond. So I think certainly there are ways to figure it out, and to keep her unimmunized may not be the best answer. And so I would suggest seeking the advice of an allergist, a pediatric allergist.
Great, thank you. And there's also just a link here now in the chat window helping about the diploid cells. There's a link giving some information on historyofvaccines.org, but I'm not sure if that is a medical publication or not.
Mm-hmm. Great, thank you. I wonder if you could post that. I'm not actually seeing it myself, but.
Okay, I'll share it here. And I actually just have a question. There's so much information out there on vaccines. I guess my doctor, for example, she's very adamant that everyone in the family gets their flu vaccine every year, and even the baby, and regardless of age. Do different doctors have different approaches to vaccines, or is there sort of a universal consensus?
Well, I mean, for pediatricians, the Canadian Pediatric Society promotes and advocates for immunizations. Again, it's not compulsory, so if parents are reluctant to give the vaccine, that's their right. But it's highly encouraged to give it. And as a pediatrician, what we would do is you would want to counsel your patients and families and figure out the reasons around why they don't want to immunize, and try and kind of debunk some of the myths that or misunderstandings or misinformation that they have. Because overall, vaccines are very safe. And I just want to share one thing here, if that's okay. I don't know if people can see my screen again.
Yep.
So parents probably have they have a ton of questions, and I did provide some resources in the beginning about the Canadian Pediatric Society, the Public Health Agency of Canada. Both of those are great resources. But sometimes you want to look up stuff on the internet, and so you want to ask yourself a few key questions that can help you decide whether or not you can trust the information you find on the internet. So number one, you want to know what's the source of that information. So does the site identify who has produced the information? Does it list all sources of funding? Does there provide a way to contact the provider of the information? You also want to ask, has the medical information been reviewed by scientific experts? And is there a date showing when the information was posted online or last revised? You also want to ask, is there scientific evidence to back up the claim? Articles from respected medical journals, for example. So those are some questions you can ask yourself to figure out if the website is good, but a very good place to start is the CPS, the Canadian Pediatric Society, and the Public Health Agency of Canada.
Thank you. Are there any other questions for our doctors that are available tonight? Oh, we have one here now. Katrina says, could you elaborate a little on what you said regarding HPV vaccination protecting against certain strains?
Mm-hmm. So there's certain strains that can cause cancer and genital warts. So there's strains 6 and 11 and 16 or 18, which are in the HPV vaccine. And those are the ones that are causing most of the illness, and so the vaccine protects against those ones. Usually, I guess parents have concerns about giving the vaccine to their teens, because are they kind of is it morally implicit that it's okay to, have sexual activity? And so, in a way, moving it to the earlier age group kind of gets around that problem. That's one reason why it's given into the younger kids. The younger kids also have a better immune response to it. What else? Anything in particular that you wanted to ask me that I haven't addressed?
Okay, if we don't have any more questions, I think we're going to wrap up for this evening. I just wanted to thank Dr. Piteau again for taking time to be with us tonight. She has a very, very busy schedule as a pediatrician, you can imagine. And at the end of this, there will be just a brief survey that you can fill out at the end to give us your feedback. CMDS Canada is trying to give more public lectures on health topics that are important to you. So if you have any comments, feedback, or suggestions, please let us know.
Thank you very much for tuning in. I hope it was helpful. I appreciate your feedback.
Thank you. Good night, everyone. God bless.
Thanks, Kevin. Thanks, Jennifer.